name's Nick Davidson. I'm a graduate assistant here for the Traumatic Brain Injury Service Program at the West Virginia University Center for Excellence in Disabilities. My day-to-day job duties entail looking at new ways for us to educate on and as well as disseminate information on the topic of pediatric concussion, most specifically looking at return to play and return to learn. Now, return to play is the practice of putting in accommodations for children when they're returning to the playing field. The other side of that I'm going to talk about today is return to learn. Return to learn is the practice of putting in short-term accommodations within the classroom after a child has sustained a concussion and is returning to school. Now, when a child sustains a concussion, in many cases, they may have some cognitive difficulties in returning to school, whether that be sensitivity to light, other things such as struggling keeping up in class, those kinds of things. So what Return to Learn does, most specifically in the first 28 days, is apply short-term accommodations so that a child, A, doesn't fall behind, and B, doesn't need more long-term accommodations such as a 504 or an IEP plan. Currently here in the state of West Virginia, through our center, we're spearheading a Return to Learn effort to educate educators here in the state on what Return to Learn is, how it's used, and how we can implement it here in West Virginia. Currently, we're in the process of customizing a manual known as REAP through Dr. Karen McAvoy in the state of Colorado that is a community-based manual that trains educators and other members within the school community as well as children's families and their medical providers on how to implement Return to Learn. We plan to roll that out sometime this spring, and we are looking forward to the opportunity that it presents to our state. For more information, visit tbi.cedwvu.org. Thank you. Have a great day.